want to welcome everybody to the Healthcare Issues Team October meeting. And I'm Mary Lynn Courtney. I'm one of the co-chairs. The other co-chair is Kim Finger, who can't be here today. She's busy touring Europe, sampling breweries, and I really feel so sorry for her. But she'll be back. She'll be back next month. She's actually coming back in a couple of days. Um, Before I introduce today's speaker, I just want to make a real couple brief announcements because I know some of you are going to have to leave before the meeting is over. And I want to make sure that first that you know that the next meeting is going to be on Monday, November 17th. It'll be on Zoom. And Larry Wallencott from the Hearing Loss Association will talk to us about the um, you know, difficulties of losing your hearing or just having it diminished. And I think a number of us have experienced that. I know I wear a hearing aid when I'm in a restaurant because the noise level makes it difficult for me to hear what people are saying. Uh, and I suspect there are others here who have the same problem. Um, Also, the December meeting is going to be in person. It'll be on December 8th, the usual time, 10 o'clock. We'll probably meet at coffee but I'm open to other suggestions and we can talk about that later. Somebody else has a particular good meeting place. The only qualifications will be it needs to be centrally located, so it's easy for all of us to get to, and it's got to have coffee. No meetings without coffee. Um, and the more information, we'll talk about more later, and I'll email you about it. And I want to remind everybody, don't forget to vote. Yeah, November 4th, I believe it is. The ballots need to be in. You've probably got them now. They went out last Wednesday. So read them, fill them out, get them in. Uh, and I also want to remind everybody that we've all got lots of opinions, and I think we wouldn't be here if weren't quite opinionated about a number of things. But these are our own opinions, and the things we talk about today will be our opinions. Both the members of our group and our presenters, they're giving their opinions and their thoughts. Um, and so what we say, whether it's actually an expressed opinion or just a question that kind of implies we have a certain opinion. They're our own. They don't represent the league or any other organization that we belong to. Um, so with that, I want to kind of uh, introduce our presenters today. First, Jim Hallett. Um, he's a lifelong resident of Washington. Uh, Moved to, but not always in Bellingham. He also lived and worked in Port Angeles and on the Olympic Peninsula, where he had a number of elected positions. He was a city council person, mayor, port commissioner, of those kinds of things. His educational background, he's a Bachelor of Business Administration, a Master of Science in Financial Planning, uh, and he then started his own business, independent financial planning and wealth management. He has certificates in certified financial planner, accredited investment pecuniary analyst, and he continues to do that kind of work. Uh, in terms of what we're doing today, um, he's a member of the Emergency Medical Services Executive Oversight Board and its finance committee. In addition to that, he serves as president of the Emergency Management, the EMS Foundation of Whatcom County. So he has extensive background and interest and knowledge of how EMS functions and the financial aspects of it. Our second presenter is Jody Ingalls, and Jim tells me that she has not really told us who she is and how accomplished she is. But I will tell you what she's willing to reveal about herself, and we'll just assume there's more to it. Um, she's a community paramedic, employed by the Whatcom County Fire District 7, that's up in Ferndale. And she's regularly assigned as a firefighter, paramedic on M45, the Advanced Life Support Unit. She has 18 years experience doing this in District 7. Um, and she's also served as a senior EMS instructor for Bellingham Technical College. Uh, she's lives here, married, two sons, and maybe the most important part of her life, she's now a grandmother. Yay! So with that, I will let them fill in any other important information about themselves they're willing to divulge, and I will leave it to them to tell us about EMS services.
I'll what I will do is just start with just a little bit of an overview of how the system works, how we got here, um, and more from the policy side of things. And the important person you really want to hear from is Jody, because she's actually represents the people that are out doing the work every day. So I'm a long-suffering Mariners fan, so tonight is their games 7. Hopefully, they'll win a pennant. But the reason that struck me is because that's almost 50 years we've waited for them to reach the promised land, so to speak. And it is about 50 years ago that the emergency medical services in Whatcom County came into existence. So if you were to go back right before the Mariners started and you were living in that period of time, I know I was, and even though I wasn't here then, elsewhere in the state, if you had a medical emergency and you had a 911 system, you were lucky. And if you didn't, you better know which number to call, or you better ask the operator, and hopefully you can get through and he or she would know where to connect you. So back then, emergency medical services were done mostly by private ambulance companies. In the community I lived in, the ambulance was dispatched out of the funeral home. So you weren't sure if the ambulance was going to show up or the black colored station wagon, because and I'm not joking, there were occasions where and there were competing medical services. And in one case, emergency, thankfully, it wasn't life-threatening, but the two ambulances collided with each other. And so private person had to transport the accident victim to the hospital. It was just that kind of fractured system. I'm not saying that's what was here, but that was really the lay of the land. And so in the mid-1970s, shortly after the state of Washington passed some RCWs, those are the laws that codify how we operate in the state, that allowed for communities to vote to create emergency medical services systems. So and the voters in this county chose, as most places in the state of Washington have done, to stand up a fire-based emergency medical services response system. So when you call today, you dial 911, you're going to go to a central dispatch, and the dispatcher will ask you the nature of your call. And if it's law enforcement related, that dispatch will happen. And if it's emergency medical related, then that call gets transferred to the fire dispatch and the EMS folks, and then that takes it from there. So that's kind of the background. And so we took a fractured system. I wasn't here then. I say we collectively, the people that came before with the vision, took this fractured system and working with all the different fire districts, as well as the various municipal districts or fire departments rather, they stood that up. And the way it's funded currently, and that's through property tax assessment. So when you look at your property tax bill, there are a variety of places that feed into that property tax. But if you look closely, you'll see a line item there for emergency medical services. So the state of Washington limits the maximum amount of levy assessment for emergency medical services to 50 cents per thousand. The voters back in November of 2022 voted to reauthorize the 6-year levy that had been voted on previously. And so in that time, the initiative for property tax assessment to fund EMS, the voters approved a rate not to exceed 29.5 cents per thousand. At the same time that ballot was approved, the county assessor had completed a major reassessment of property values. And so at the time, the county council, the county exec needed to ratify that and determine what levy rate. Property values had gone up, and for a variety of reasons, the county council and the exec approved a much lower rate, about around 25 cents per thousand. So the voters have yet never been fully assessed on the rate they approved, but that's established what is called the highest lawful levy limit. And I know I'm getting into the weeds here, and I'll try to be brief as possible. But that highest lawful levy limit says the county policymakers, the county council and the county exec can increase the amount of rate collected, but not to exceed what the voters approve. So the differential between what the voters are currently paying and what they can collect off of that difference is what's called banked capacity. In other words, that's money available, but it has to be a policy decision by the council and the county exec to take that. And that's a significant thing for the league to pay attention to, in my opinion, because right now the EMS system is revenue challenged. Partly not because there weren't assumptions in the levy plan for what to do over a 6-year period. But I can tell you, as a former elected and as a planner by profession, when you're looking 6 years into the future, it's hard to know with 100% certainty what you're going to face. So you may recall there was a thing called COVID that we all lived through, hopefully. And that created an unusual set of financial circumstances, including a highly spike in inflation early on in this current levy cycle. That, coupled with just rising costs, have put some strains on the system. The biggest expense, as you can probably imagine, is personnel, and but that's not unusual. Any entity that provides service, that is your highest cost, but that's also your most valuable resource. So what we have now is a levy plan the voters approved, and that levy plan, the detail that's available for anybody to look at. One of the things it called for was the establishment of community paramedic programs. Jody will talk about that in just a moment because she is a community paramedic. Unfortunately, because the revenue hasn't kept pace with expenses, we have not fully stood up the planned community paramedic program. So there are 2 community paramedics in the city and 1 for the rest of the county. The plan called for 5. We haven't been able to fund that. The other thing that the plan called for, thankfully, we were able to put that into place earlier this year. And that had to do with another advanced life support unit to serve the greater rural area. It's still, in my professional opinion, we probably still need maybe 1 more ALS unit, but that's a to be determined. So this is where we are. There will be a budget discussion at the county council here later on in either, I think, early November, and before the final budget is proposed in early December. And one of the things that's been will be presented to the council is asking for their authorization to a resolution to pass action that would take some of this bank capacity and allow that to flow into the EMS system. That will give additional revenue, depending on the value of your home. If you had the median home price of around $650,000 in the county, you may be looking at about a $24 a year increase. But there are other things we all pay property tax for. I get that, and I'm thankful I'm able to pay those taxes because I believe, for a variety of reasons, we get value for the services we pay. But that being said, so that's an important thing I think I would encourage the league to pay attention to. And if you feel strongly to speak up about that and encourage the county council and the county exec to support that resolution, which was recommended by the oversight board a week or so ago back, to take to the council to increase that revenue, that would be helpful. So that's where we are. That's how we're funded financially. That's a brief history of the EMS system. One thing I should tell you is that you should be very proud of folks like Jody and others. And the reason I say that is our even though our levy rate ranks in the bottom quartile of all EMS systems in the state, many EMS systems collect substantially more than the voters in Whatcom County are currently paying, yet they don't get necessarily the same successful outcomes. One of the ways that EMS systems around the country are measured is what is the success rate responding to cardiac arrest or sudden cardiac arrest. That's the #1 killer of folks that have medical emergencies. There are a lot of other emergencies, but this is the one thing that can be measured and recorded. And so, years and years ago, when EMS systems were first coming to existence, King County in Seattle was one of the forerunners of that, and the importance of citizen CPR training, paramedic training, variety of things like that, with the focus on if you're going to have a medical emergency, say cardiac arrest, your odds of success are much greater, in the state of Washington, even today, than they are anywhere else in the United States. With that being said, Whatcom County's success rate for sudden cardiac arrest is on par, if in some cases superior to almost every other EMS system in the state. So the voters in Whatcom County currently are paying some of the lowest rates for EMS and getting some of the best results. And I can speak personally to that because I am a success story, having experienced, it wasn't planned one morning, but I had a sudden cardiac arrest, and the paramedics were even at my house before that. And so, I'm a living proof that the folks in the EMS system know what they're doing. And I have nothing but gratitude for that, which was led to the establishment of the foundation itself as a way to say thank you and to recognize the need to care and support the folks that do the work. So with that, I'd like Jody to speak to what she does, because Jody and her peers are the people that actually do the work. They're not somebody you want to see in your house necessarily, or out on the street, because that means there's probably a need to see her. I'd rather see her for coffee and just have a nice conversation, and she's great at that too. But that being the case, she can talk about the two-tiered approach. Most of the calls to 911 for medical may be basic life support response, but if the determination is made for advanced life support unit, there's a finite number of those to scatter around the county. Then you'll see an ALS unit come as well. So you might see two pieces of equipment showing up at a scene. But let me pass the baton to Jody and let her fill in the blanks.
Thank you, James. And thank you guys for letting me come and speak to you, or thank you, ladies. Sorry, I'm feeling all of a sudden very shy, but I think it's because that kind of tapped into the emotional side of me, just hearing you talk about your own personal experience. And thank you, because we don't want to hear about how well we did. We love to hear about how well you did, and the fact that you are a survivor and that you are doing so well. And we just really appreciate that. So those kind of stories, they kind of cheer me up. So I wish I had had 5 more minutes to recover from you talking. My name's Jody Ingalls. Right now I'm working as the community paramedic out in Whatcom County. District 7 is my employer. They are contracted by the county to provide community paramedicine in pretty much everywhere but the city of Bellingham proper. So I have clients that are out in Marietta. I have clients in Acme. I have clients out in Everson, in Linden, many in Blaine and Ferndale. And then I watch those areas every day that I'm on work, looking for people who are using 911 more than you would expect. We call them high utilizers, but sometimes that could just be someone using 911 3 times in a week. And that makes me say, I wonder why they went to the hospital 3 times this week. I'm going to check on that. Maybe they're not getting the appropriate, like what they need. And so that's part of what my function is to look at those and try to figure out why a patient is using 911 so often, because it's hard on the system and it's hard on the patients, right? They're not getting that need filled. My other job is to receive referrals from community members and stakeholders. That could be a neighbor, that could be a firefighter or EMT or paramedic out in the field. That could be a stakeholder, someone from local community services. So every day I come to work and I look at all those, the referrals and the utilization. I do some research and I make contact with patients and try to get them the help they need. There's been quite a few questions. And James, I don't know how you want to handle this. Maybe I think the best thing for me right now is just to start with what I do. So as a community paramedic, I'm responsible for an awful large area and a large number of people. And we try to triage that at this point, and I try to help the most needy. There's a lot of need out here in the county. In Bellingham, there's a lot of need. They do have 2 community paramedics. They deal with a lot of homeless and drug use out in the county. Most of my clients are the elderly who maybe don't have family, and they're kind of suffering silently until EMS might come to their house for a fall and sees the living conditions or the lack of social support. And that's where we come in and try to identify what their needs are and try to get that service to the patient or client before it becomes life-threatening. So do you have any questions?
I saw a question in the chat. The person was wondering why a fire engine comes along with the ambulance.
Yes, I love that question. That's a very common question that we receive. As you know, as James said, when it comes to EMS, one of the biggest expenses is personnel. And so we have something called minimum staffing. And so that means, like in District 7, we have minimum fire suppression staffing of 7 personnel for the whole area. And so I have, we have maybe 3 firefighters and firefighter EMTs at a station, and they will staff an ambulance and an engine. And so often, let's say if it's a very serious call, say a cardiac arrest, all 3 will come to the call. If we have a volunteer, that's great. That means we'll have 2 on the engine, 2 on the aid unit. But more often than not, we just have the 3. And then an ALS unit will also come to the call that's staffed with advanced life support paramedics who can give cardiac medications and assist the breathing, have a secure airway for the patient and so forth. So oftentimes that engine has to follow the aid unit so that they can have their fire engine ready too if there's a fire call. If it's a situation where we might have 2 on each rig, we still need to have all those personnel at the call. And so we'll bring the engine and the ambulance with us. Unfortunately, it's just the best, most efficient way to maintain coverage. When that call ends, that fire engine is immediately in service to respond to a fire call, as opposed to the whole crew having to drive back to the station and then get on an engine, which would use up time. Maybe 5 or 10 minutes out in the county is quite a distance sometimes to get to our calls. So the main reason why that engine comes is to deliver personnel. It's almost the same, it is basically the same idea with police response. If you have a serious police response, you're going to get a lot of police cars at a scene because each car is only staffed with one police officer. And so those vehicles basically are a way for us to getting personnel to the call. So it's kind of twofold. Does that answer that question?
I don't see any. I just have two questions related to that. And so I don't see any other questions right now in the chat. As you were talking, I was wondering about what the relationship of the community support services are to the GRACE program. It sounds like they're doing similar things, or at least are complementary things.
Yeah, that's a great question. For example, I had a gentleman that was referred to me by EMS. He had very poor living conditions. He's elderly. He could barely walk. He had fallen. He walked with a walker, but he needs both hips replaced. He was very muscle wasted, very small and thin. They had taken him very poor with living conditions, no hygiene what's to speak of. And they took him to the ER, and then the doctor filed an adult protective service report on him. And the next day I came to work, saw this, and made contact with that patient. Established a rapport with him, and he agreed to let me help him. I took him to his doctor's appointment, then arranged for him to see a surgeon, an orthopedic surgeon. And then at that point, it was told to us that without better hygiene, better care, wraparound care for him, the surgeon would not do the surgery. And it was my opinion that this guy would not survive if he did not get this resolved. And so then I made a referral to the GRACE program, and the social worker assigned to the county through GRACE agreed to meet with me and then with this gentleman. And now that gentleman is getting in-home care and hygiene, and someone's cleaning up his place, and they're going to arrange to have him have the appropriate assisted living care so that he can get the surgery that he needs to continue on. And so that is how the community paramedic and GRACE program are working together in the county.
And let me just piggyback on what Jody said. One of the things that I was fortunate enough to be able to do is working with the very small staff we have at the EMS administration office. In fact, we have our original EMS director is retiring, and Debbie Arthur, who was working at Western Washington University, was recently appointed and has just taken office as the new EMS director for the entire system. But one of the things that we did earlier this year was we walked through the entire budget, took it apart, and looked at all the assumptions that went on the revenue side and looked at all the assumptions that were built in on the expense side. Is the revenue coming in the way we expected? Well, in some cases, yes, and in many other cases, no. And on the expense side, most of the expenses are in line with what we thought, except for some inflation outliers. The community paramedic program is not an advanced life support system, and that is the overarching objective for the emergency medical services. So, however, when we undertook this, it became clear to those of us who were working with some Western Washington University interns who part of their degree requirement was to mine data for information objectively. They had no stake in the game other than just to be objective at looking at that. And it became clear, I already felt this personally, but it became clear how significantly important community paramedicine is. It is not somebody who is in a life and death situation necessarily where moments and seconds count. However, the community paramedicine program in our county and elsewhere, well, at least in our county, hasn't been fully stood up. It hasn't been fully funded because the revenue just isn't there to do that. And so policymakers are having to decide, well, where do we go? If they see the value of community paramedicine, as Jody so well described, that relieves the stress on the EMS system. That gets care to people who aren't frequent dialers of 911 for things that an objective assessment would say, well, that's not an emergency. It could become one, or it could take limited resources for somebody there who, and then you have somebody like Jody who has to be two places at once. I mean, how do you do that? So here's again where I would encourage your members to pay attention to the discussions happening at the budget process, because this is where, this is my opinion again, getting that additional revenue that's legally available to the system for the policymakers to stand behind that can help keep that community paramedicine program functional. Because in the long run, when you cost avoidance is a one way to offset the need for additional revenue. So if you think about it that way, the work that Jody and the limited other community paramedics are engaged in is keeping increasing costs potentially out of the system. And at the same time, meeting the human needs that all of us will face if we live long enough, maybe, or people we know about. They don't make the headlines. There's not an ALS unit in their driveway with sirens flashing, going and things like that. But they still deserve care and compassion and kindness. And that is the unheralded work that folks like Jody do.
I see some more questions in the chat again. Someone asked that you speak a little more about the helicopters from St. Joseph's. How do you alert them when you need them?
Great question. So there are some communities that use the helicopters for their ALS response in addition to a medic rig. And that's because sometimes, for instance, in the case of a stroke, time is brain. And so if someone on Lummi Island is having a stroke and Airlift Northwest is available, they can get to the island quicker. And even if they can't get there quicker, because of course it takes time to get the bird up in the air, right? They have to go through a whole process. It might take 5-10 minutes to get that bird up in the air. Then they will definitely be able to get the patient to the hospital quicker. And so when the medic unit will, of course, head there too, sometimes the airlift can't launch because of weather, or because there's none available. The closest one might be out of Seattle. So we'll go to, and then once airlift is on the ground, say on Lummi Island or up in Point Roberts, then the medic rig will clear. Unless if it's a cardiac arrest, maybe both Airlift Northwest and the medic unit will combine their efforts to provide that care right there. And then once we achieve a return of spontaneous circulation, we like to call it ROSC, then the airlift would transport the patient to the hospital to definitive care quicker. And recently, we've just changed our protocols. And so even when we're not in outer lying areas like Maple Falls, Point Roberts, Lummi Island, areas that have traditionally used the helicopter service, even if we're, say, somewhere in Ferndale or out on the reservation, Everson, Linden, we can use airlift to provide blood products to a patient who's having who's had a car accident where they have life-threatening bleeding. And so we're going to be utilizing the airlift more often now to provide blood products in the field.
That's really good to know. The next question I saw in the chat was if a person has a pulse directive, and perhaps you'll explain that as you're answering the question, do they have to carry the original documents with them when they leave the house? Are bracelets accepted, these pulse bracelets accepted by EMTs? And do EMTs have access to advanced directives? For instance, the ones at Peace Health in my chart.
Yeah, that's a very good question. The technology exists for us to have access to pulsed forms. It's just not, we just haven't, our common practice hasn't taken advantage of that technology yet, and some of it is because people don't even have their pulsed forms available. We don't, like when I go to someone's house for an emergency call, if uh, if it's not relevant at the time, I won't ask them for their pulsed, and then it will not become part of the record. But we do have that technology, and I think we'll see it more in the future now that our software is able to access that in the field. So that's a good question. We typically don't take a do not resuscitate from tattoos or non-official items. So you'll see a lot of different ways for people to communicate that they don't want to have extreme measures. But what we do like to look for is that legal piece of paper, a pulse, that it's a green form, and we like to see it on people's refrigerators. If you really think that it's a necessary item for us, or more likely to show up, and there's a potential for cardiac arrest, I encourage you to put it on your refrigerator somewhere out in the open where we can find it easily. We do make cursory looks. An officer will make a cursory look for an item like that when we're on the call. Of course, patient care comes first. And if we don't have someone right there with the pulse form, or a family member right there saying, my father's got terminal cancer and he doesn't want to have any extreme measures taken, then we will provide emergency care regardless, right? Please recognize that if you have that situation at the hospital at any time, that can be revisited, right? Even if we did get that return of spontaneous circulation, or ROSC. I've been on calls where it was a post was signed, but the patient wants to go in. So they've reversed the post, and of course, it's always what the patient wants in that case, or their power of attorney. Medical attorney. So post is a kind of a complicated thing. I don't know about bracelets. I haven't seen those, but I would probably treat them the same way I would as a tattoo. It would be supporting evidence. Say if a family member is saying they don't want to have extreme measures taken because they're, say, have a terminal condition. But as a rule, we like to see those pulsed forms, and if you can put them on the refrigerator, that would be excellent. Please recognize that pulse forms are only good for so long. And so even if we did start to include those in our records, and we're able to pull up that information on a repeat patient call, that pulse may be expired. So they're usually good for a year, or some finite amount of time.
When we're telling people, when I'm giving presentations to people about disaster preparedness, we do suggest that if they have something like that, they post it on the refrigerator along with other emergency phone numbers, contacts, things like this. And we also suggest that if you don't want this posted on your refrigerator for the neighbors to read, that you either turn it backwards with, the word see, see the other side, or a note saying it's in the silverware drawer next to the dishwasher, something like that.
Yeah, I love it. Yeah. And also you could add medications to that list of things. I know I told my mother-in-law, please put your list of medications on the fridge too.
Yeah. And do EMS look for the bracelets and the necklaces? And actually, there's ties that you can put on your shoes.
Yep.
With that, okay.
Yeah, we sure do. Yep, we do. We look for all kinds of clues. We're always sometimes we have to be detectives, and very fast detectives.
Oh yeah. Okay. Next question I had you. Can one of you tell the members about Pulse Point? I found this app to be a great way to build an understanding of EMS deployment. It's amazing to see how many incidents occur in a day. What is that?
That's a good question. So it's funny when it first came out, like for citizens, right, for lay people, and then we had access for it too. I used to look at mine quite a bit because Pulse Point is an app you can download and sign up for a particular area. So in Whatcom County is where I am. But if I go to Florida, I can sign up to receive it in Florida. I can choose that area. And then if someone's having a cardiac arrest and CPR, as a layperson, it'll give you a little alert that there's someone in your area. That did happen to me when I was in Miami. I just wasn't, I was too far away from it for me to actually logistically respond. But you get a little note that there's a cardiac arrest and you can go to the scene, and it's in a public place, right? Not in a private party's home. And then you can help provide CPR.
Who provides that information to Pulse Point?
Well, I can't answer that definitively. I would have to think that they have some kind of agreement with the dispatch for that area, but don't quote me on that one.
Okay.
Speculation, informed speculation.
Okay.
One of the benefits of that program, it coupled with citizen CPR training, is it really can be a very critical difference between life and death. And I was fortunate enough to share some time with folks that ordinary citizens, just like those on this call, who one had recently taken CPR training that's provided oftentimes with little or no cost to residents of the county from folks like Jody and others. So if you haven't taken advantage of that, please consider doing so. In this particular case, it happened up near Ferndale. A person was at a public gathering and went into some distress, and a friend was wise enough to recognize that this may be indeed an emergency. So the call went to 911 for medical emergency. But before any paramedics were able to show up, and they weren't that far away, this lay person was faced with the choice of putting into practice what they had just learned. And that made the difference between that individual's survival. So do not underestimate the power each of you have to participate in the life-saving for your friends and neighbors, or even a close family member. So, that's a great part. Our goal as policymakers, ideally, and I'm sure Jody would echo this, would be to have as many folks, lay people in this county, trained to recognize a medical emergency, and the one that again gets measured the most, not that it's the only one, but is the ability to be success when it comes to cardiac arrest. So that your participation in that is so important.
Okay. Would you be able to provide me with a list of CPR classes that are going to occur, and perhaps also stop the bleed, which is also very useful information to have? And if so, then I will send an email out to our members letting them know when these classes are.
Yeah, Jody and I can follow up with you on that, no doubt. We will do that.
Okay, thank you. Thank you.
Sure.
And another question is, it reads, my understanding is that pulse forms do not have an expiration time, such as one, let's see, I'm sure I'm reading, yes, do not have an expiration time such as 1 year. Pulse forms should be reviewed periodically, however, because wishes can change. If a new pulse form is completed, the previous one should be voided with a line through it. She says forgive me if this comes across as contrarian. She didn't intend it that way. It's just the
Oh, that's
information
okay.
she has.
No, absolutely. Sometimes we do have, and I may have been thinking of advanced directives, but there are expiration dates on some of these. And my understanding that some of them are a year. So if I am wrong, that's fine. I would just, what I recommend you do is discuss that with your doctor. And make sure, because you'll need to have a doctor's signature on your post form.
And I'm wondering, advanced directives, as far as I knew, I thought they were in effect until they were changed or repealed. Um, is that true, or is my understanding incorrect? And I should be back talking with an attorney again.
Yeah, that might be attorney talk. For us, we want to make sure that the post form is still good. So I do see we've got a date on the form, and there's a review of the post. So I'm actually looking at the
Uh-huh.
actual post form. So, and I'm not seeing anything on this post form that says there is an expiration date, but I have been told. So maybe I was just going off what I had been told without reading the actual document here. So I can certainly follow up with you on that.
That would
Unfortunately,
definitely be
you'll
great.
have to forgive me. I teach at EMT class, and we teach this legal area, and so but we teach for national standards. So my saying there could be expiration dates are probably based on that nationally there can be. The pulse that we have is for Washington State, and
Okay.
that I'm not seeing a expiration date on there, although that it is mandatory that you have the date of signatures.
Okay. So any information that you send me, I will again send out any
Sure.
updates.
Okay. I'll send you a copy of that.
Okay. And then the other question again reverts back to CPR. Can high school students take CPR classes and there's an age minimum, like 18 or anything like that?
Oh yeah. We've taught CPR to 6-year-olds. So you can
Wow.
definitely take CPR. In District 7, we have free CPR classes we offer to the community. And you can find those dates on our website at wcfd7.org. But I can also provide you with that link. And I've taught some of those classes, and we've had kids as young as 6 and 7. Yep.
Wow. It's good information for them. Yeah, definitely.
Yeah, we at Pioneer Park, we have a Pioneer Days, and we always have a CPR booth there, and we teach kids CPR all day long.
Okay. Yeah, if I could ask a question about revenue sources, I know you mentioned property tax, and I suspect that's probably the primary source. But do you have any other sources of revenue? For instance, can you bill insurance or Medicaid or Medicare for any of the services that you provide?
I'm going to I cannot speak to the billing portion. Maybe Jody can. What I can tell you, there are other revenue sources that flow into the EMS system. Those will include sales tax, and not necessarily just the sales tax you might pay when you go to Costco and buy a microwave oven or something like that, but also the largest sales tax driver in this budget has to do with property sales and new construction. So if there's a slowdown in the economy, either in Washington State or based on policy decisions out of Washington, D.C., for example, that can affect a slowdown in that area, that can affect the sales tax revenue. One of the other things that's front and center right now and has been somewhat problematic for the EMS system is reimbursement from the Centers for Medicare and Medicaid. And this is called GEMT, or Ground Emergency Medical Transport. So this first kind of came front and center during COVID, when there were unprecedented demands on emergency services, and systems just didn't have the capacity. I mean, you're sending people out all day long, but the funding source didn't anticipate that kind of demand. So the federal government created a program that would reimburse communities for those costs. And so for medical transport, that would be covered. That revenue source is under stress because when you're looking at cuts to Medicare and Medicaid services and reimbursement for that, then that falls to the EMS system to cover that. And I will need, personally, I would have to follow up with you on the reimbursement portion of that or balance billing, but typically in most cases that should not be an issue for residents. I don't know, Jody, if you have any other information in that respect, but the GEMT, ground emergency medical transport, makes up a not an inconsequential amount of the budget. So if that becomes problematic to the EMS system, then that's just another stressor on the revenue side of things, which means we're already stretched thin. As I said, some of the lowest rates in the state and some of the best outcomes, but you can only go so far that way before something potentially breaks. And so if that revenue is reduced, and we're planning for that to happen, we have to make priority adjustments, and we prefer not to have to cut services if at all possible.
Yeah. What are you able to bill insurance for any of this? Any kind of insurance, or and I know there were I think it was legislation last year before the state legislature regarding ambulance services that was going to I think it was related to now billing maybe maximum billing rates for that. Do you know anything about that?
I'll speak. I know we do bill insurance and we do bill Medicare. Um, and we have a policy, and each department is going to be a little different, but we make policies on what we charge for and what we don't. And so we usually don't things that we wouldn't get reimbursed for, we wouldn't charge for usually. One of the things would be like when we show up at someone's house and we provide care, but not transport. If it's for just basic life support, maybe we spend an hour at someone's house calming them down. It's an anxiety attack, basically, and we help them through it, and then they're able to stay at home. They don't receive any charge for that, right? And so we just can't bill it. And it's not something that insurance would pay for. So we don't put that on the patient. But if it is something that insurance will pay for, then of course we'll try to recover those costs. I know that we do provide a lot of charity. So if a patient goes to the hospital and the hospital determines that they don't have the resources to pay their bill, then we will also extend that same courtesy to the patient, and we will not charge them for the services, for the transport.
I would suspect the services you're providing right now, the community support services, are not billable to anybody.
No, and my understanding is in some areas they do bill for some things. We don't bill for them in Whatcom County, at least not. I don't believe Bellingham does either. Bellingham Fire Department is their employees provide the 2 community paramedics in Bellingham, and then District 7 provides the community paramedic in the county. But no, we don't even have a budget. If I want to buy a client a hash brown and a breakfast burrito because she's really hungry and we haven't established some way to get her regular meals yet, that comes from charity from the Chiefs Association.
So what association is that? That might be of interest to somebody here, if this is some kind of a 501c type of thing.
It's the Fire Chiefs Association. So I just know there's a lot of chiefs on it.
Okay. Okay. And there was a comment here. It wasn't really a question. Pulse Pulse Point works. This person completed the CPR class at Blaine Fire Department, and registered for Pulse Point. And while at Costco in Bellingham, he received a tone that there was an event at Fred Meyer's across the street, and he responded and helped the Bellingham Fire Department.
Awesome.
So this is something worth investigating, finding out what it is, and getting a CPR course. Definitely. Yeah. I'm not seeing any other questions in the chat. Is there anyone who wants to raise their hand or just wants to speak out and ask a question? Oh, Sherry.
Well, there's a question in, am I on mute? No, there's a question in here about self-administered CPR. Is that even
Is that?
possible? They last week I read an article on self-administered CPR. Can you demonstrate this, like blowing a balloon when you're alone? I mean, is there a way to do something when you're alone?
Well, part of the, so I might not understand the context, but part of the need to do CPR on someone is when they are unresponsive. And that's one of the criteria. So that person, I'm not sure how they would do CPR on themselves if they were unresponsive. However, that being said, they sometimes when someone's choking, they can do some immediate things like push on their, where they're right underneath their xiphoid process, and kind of do an upward inward motion on their diaphragm on a chair or some other object. So maybe they were referring to that kind of maneuver, which can help and make a difference.
Would that be covered in the CPR classes, that type of thing?
It sure would. Yep, we would talk about that and the importance of, you know, making sure your door is unlocked and open, and other things to do if you started having an emergency like that. Yep.
Elaine, you have a question. And you're muted.
There we go. I'm unmuted now, I think. I put a private question to both Jody and James, but maybe they can look at it for more details. But I'm wondering if there are any situations, Jody, where you and your team is aware of, we don't use the term frequent flyers, but whatever the term is correct, and that this person may need different lodging and different services than they now have. Can you tell me just a little bit under what circumstances you are James might be in a position to advocate for somebody who needs more services than they're getting?
Absolutely. And that is and James, I don't know if you want to speak to this. That is the job of a community paramedic. That's what we do. So we deal with, there are words, we try to avoid the word frequent flyers, right? But yes, I absolutely understand exactly what we're saying. What we're saying is, here we have an individual who is leaning on 911 system because we're there. You know, if you call us, we're gonna show up. But because they don't know what the appropriate services, or they don't know how to access appropriate services. And so community paramedic looks at EMS referrals and stakeholder referrals, but we also look at utilization. So I have I have software that I access each day that shows me who my high utilizers are. And I follow up on them to see if they are getting the help they need. For example, last week or the week before last, I had a gentleman who had not had any calls to EMS since, you know, for a long time, over a year. And then all of a sudden, 6 calls to EMS. Yeah, and I managed to catch him at the hospital on the 6th one. And we found out that he had been to his primary care provider. He had called 911 and gone to the ER multiple times, and it was actually he had pneumonia, but he wasn't, because of how he presented, it wasn't clear, and he didn't get he wasn't getting the appropriate tests. And so just by intervening and getting him actually seen at the ER, we were able to find out that he actually had antibiotics, and he had pneumonia and needed antibiotics. And that was the last time that he basically, well, and then he had a reaction to the antibiotics, but he went by personal vehicle. And then now all of that has been taken care of, and he's not calling 911 anymore. But he just it wasn't happening. So he's an example of it, just the system not working for him. And so the community paramedic position is part of this new system that actually will work for those, what you were calling frequent callers, or that are high utilizers. And our goal is, I mean, it's not that they will never call 911 again, because we want people to call 911 for emergencies for sure, right? That's why we're here. It's to help connect them to more appropriate care so they can actually get the help they need.
And the thing about this, Elaine, and for the rest of you too, is that there's a distinction between the paramedic that shows up in an emergency. That's, there's a lot of training that goes into that in our paramedics, and this is also an objective statement, are some of the best trained. They're certified. There's national standards. I'll stand our community paramedics up with any others, our paramedics with any other paramedics in the United States. Okay, that's statement number one. The community paramedic program that you're referring to, Elaine, and that some of you've asked about, and that Jody is doing this first-class job on, that is a relatively new concept for the EMS system as a whole. The levy plan called for 5 community paramedics, okay? 2 in Bellingham and 3 out in the county. Jody can't be all these places at one time. So we've not expanded the community paramedic program to its full capacity. So again, here's my invitation to all of you. If you feel like what you heard Jody talk about today, you would like to see this program not only continue, but to become what it probably can be for maybe you, your family member, or a total stranger you don't even know, that you think there's value to this, speak up. Policymakers need to hear how you feel. I can tell you from personal experience, when people come to hearings and they talk, most policymakers will listen. And if the choice comes down to the unpopular decision of saying, well, we're going to raise the amount we collect from you, maybe $24 a year, for example, and that'll help fund a community paramedic and maintain the integrity of our system. If you are okay with that, then say so. Because if you stay silent, what'll happen is it'll be easy to sweep this under the rug because it's not glamorous, it's not sexy, it doesn't involve emergencies necessarily. But this is my opinion again, I feel so strongly about the importance of the community paramedicine program, not only what it's currently doing, but what it can do, and maintain the integrity of the system so that we can continue to deliver world-class results. And I think all of us deserve nothing less than that.
Okay. Well, thank you both Jim and Jody. Thank you for coming here today and telling us all about this. This is really important information. And as you said, no, we don't want everyone, particularly we don't want to see Jody in a professional capacity. But we're delighted to know that she's there. She and the other paramedics are there to help us if we need this. We really appreciate your taking the time to inform us about this. Oh, I see Sherry is waving her hand again.
Can I just ask one more question? You have a levy coming up next year. The paramedic or the EMS levy. don't you?
Yeah, we will, the levy for the next cycle. So this current levy, 6-year levy cycle, some systems have annual levies. Some for EMS, I'm talking about. Fire districts are different. Although they're part of the EMS system, each fire district or does their own thing or can. But the next levy rate would go to the voters in 2028. So this coming year will be the time to stand up at the start the levy planning process. So that would involve, from my perspective, I would approach this as we ask ourselves, if we were to build an EMS system from scratch today, what would we do? What would we like to include? Does community paramedicine have a role to play? Do we have our advanced life support system units in the right location? Do we need more of those? I mean, those kinds of questions, so that you can then come to the voters to say, we've thought this through. Here's the game plan for the next 6 years. Do you support this, yes or no? If the levy rate is proposed, I don't know what the levy rate proposed will be, but let's say for sake of discussion, it's 29.5 cents, which is what the voters approved in 2022, then it takes a simple majority of the voters in the county to put that into effect. If for some reason we need to collect closer to what the average EMS system in the state is collecting, which is in the mid to high 30 cents per thousand, if not 40, somewhere in that range, then that would take a super majority of the voters to put that into effect. So, but the levy planning process will get underway for the next 6-year cycle next year. And so just stay tuned for that. And community input is going to be vitally needed for that, Sherry. So if you have questions or you want to talk further about that, please let me know.
Again, I want to thank those of you. We'll now move into kind of a business part of the meetings. You're welcome to stay for that if you feel like it, but I know you're both busy people also, and have other things to do. Thank you very much.
Thank you for having us.
Yeah.